वेलकम टू रेडियो बूस्ट। एक बड़ा फेमस कोट है, प्रैक्टिकल लर्निंग नेवर एग्जॉस्ट द माइंड। और ये ठीक भी है, क्योंकि हम जितना प्रैक्टिकली चीज़ों को करते हैं ना, उतना ज़्यादा हम ग्रैब करते हैं, उतना अच्छे तरीके से हम उसे सीख पाते हैं। सो प्रैक्टिकल लर्निंग के ऊपर आज मैं आया हूँ एक क्लिनिक में डॉक्टर से मिलने के लिए, जिन्होंने एक नया इनिशिएटिव लिया है कि वो अपना जो उनका कोर्स है उसे प्रैक्टिकली लोगों तक पहुंचा रहे हैं। लोगों तक एज इन उन्होंने सेलेक्ट किए हुए कि उन्हें किन तक पहुंचाना है। सो आज मैं आया हूँ डॉक्टर मेजर चंद्र प्रकाश के पास। वेलकम सर। सो डॉक्टर मेजर चंद्र प्रकाश जी, सो डॉक्टर साहब एक नया इनिशिएटिव ले रहे हैं और इनका जो एक क्लिनिक है, सबसे पहले मैं आपके क्लिनिक के बारे में जानना चाहूँगा कि आपका ये जो क्लिनिक है यहाँ पर, ये बाकी क्लिनिक से कैसे डिफरेंट है?
I always says that there is nothing different here. I do work differently. That is the USP of our clinic. That we also have been learned the same kind of anatomies and the basic surgeries protocol which everyone is following. But we try to do something which is more compassionate for our patients. So we are trying to do something differently for our patients for their comfort zone, and we always go with that. So this is a clinic for dental per se, with the oral and maxillofacial surgery, and by the we have a name like Kreative Oral Surgery, and another clinic is Kreative Dental. So we are looking after mostly the dental patients here, along with those patients which requires minor surgical as well, like the wisdom tooth surgeries and other surgeries or facial surgeries and some cosmetic surgeries as well. And the implant is one of the minor surgeries which we are doing here. So this is a creative oral surgeries which is mainly because of the implants and oral and maxillofacial surgical procedure, which can be done under local anesthesia and conscious sedations without getting admission into a hospital setup.
So this is the name of the clinic,
Creative Oral Surgery.
Creative Oral Surgery. So what's your initiative? You just talk about training academy, dental training academy. So what is that?
See, I am into this profession from last 19 years, and before starting the practice, I was in the army, and then after leaving the army, getting released from the army, I joined the Safdarjung Hospital, and 3 years I worked there in Safdarjung Hospital also as a senior resident. And post that, in August, in 2012, I started my practice. See, we are doing a number of patients of dental as well as implants and the surgical procedures. After doing 10 years of practice, I have noticed that patient comes, doctor साहब की appointment चाहिए, doctor साहब से हमें implants लगवाने हैं, doctor साहब से wisdom tooth surgery करानी है. I mean, mostly I have seen in our general day-to-day practice, like the people are so good here once they get relief in their particular ailments, particular diseases. They always consider that even a minor works or the major work done by the same doctor. So this is what I have faced. Like, I cannot accommodate more than 10 patients in a day. Although I really want to work for them, not for the money, but only for the for their treatments, where I also feel sometimes happy that I am doing for my patients.
Yes.
But after doing 10 patients, I cannot do much. I am also thinking that I am getting tired day by day after doing these number of the surgeries or implant surgeries. So I do have a staff, 3 or 4 doctors are working with me from last 3 to 4 years. One doctor comes and at least 3-4 years they work here in this center, and then they started their own practice also. So at that point of time, I thought maybe I should get more patients. But yes, I should train those practitioners and those clinicians, those who are already having a good experience of more than 15 or 20 years, and sometimes more than 20 years as well. Because at one point of time, I have seen that the advanced as well as the digital dentistry, the dentistry which is required today's scenario, is started after 2000, year 2000.
Okay.
And those who have passed out before that, they have not got such kind of exposure in the dentistry. So they are into practice. They cannot give full time to learn something new. They cannot go out. If they want to join some college, they have some age related issues.
Yes.
And some issues that they are the sole earners, sole in the families they are working. So they cannot go for 4 weeks or 6 weeks or maybe for 6 months for mastering those subjects. So along with one of my colleague, Dr. Satyavrata, who is right now in University of Buffalo, he's a DDS and he's a maxillofacial surgeon from AIMS. So we both have thought of a new initiative in the field of clinical dentistry, where we are training the doctors or clinicians, I'll say practitioners, those who have more than 5 years of work experience,
Yes.
or those who have done at least 3 or 5 years of work experience in general dentistry, and they want to have one step ahead of it to learn something advanced like implantology. We have chosen first because nowadays it's an era of implants.
इसको ना थोड़ा आपने ना you have made it more distinct, please, starting से.
The people are not going for any kind of fixtures or kind of a dentures which is supposed to be taken out every night and they are putting it in the box. No, we are going for something cosmetics as well as functionality.
Okay.
So we thought of we should train those clinicians, practitioners, so that rather than everyone coming to those centers or in the NCR region, in the far away, in the rural region, those who are practicing, they should also start with the implants. It's nothing new. The only thing is they are not exposed with such an environment. So we are calling those guys, we are giving training to them so that they will be trained in the kind of a dentistry which everyone likes. Like we are trying to have some kind of module systems where these practitioners can come on Saturdays, Sundays or any holidays, at least 2 days or 4 days in a month, and then they will be treating their patients from starting till the end. So this is what we are trying.
So is there any criteria to be part of this practice academy? मतलब कि age restrictions है या आपके पास
No.
इतना experience होना चाहिए इस kind of-
I don't think so. There is no age restrictions. Even double of my age, those who really want. Only thing is, I guess one practitioner should have zeal to start with something new.
Okay.
If you really want to learn something new, there is nothing no for that. There is no age related. I always considered whosoever is coming to learn something new, they can come at any age. Only thing is they will have to take out time, at least 8 to 10 hours for one particular module. So that in case if they are coming here in Gurgaon for 2 days, they can learn something, for that 2 days. And we are going for 3 months complete structure of training for one particular system like implants. So we are not per se training in implants any system. System means there are a number of companies who are manufacturing the implants. Some Sweden based, some German based, some France, some Spain, some from Israel. So we are not training them to use any specific system. We are training them to know the basic of implantology, so that they can start with any system. Any system means any company. So this is what we have the total planning of basic implantology, and then advanced surgical implantology, and then mastering the implantology. So those who will cover up the basic implantology in first 3 months, if they want to start their practice in basic implantology, and then they come across those patients where the basic implantology doesn't fit, then they can go with advanced implantology course. Then again it will be for 3 months. Means 2 days module system every week, or once 2 days in 1 month. So in that case it will be somewhere around 48 to 50 hours of training schedule for those practitioners. And as you asked for the age related, no age related, anyone can come. Those who have experienced more than 3 years at least, more than 3 years at least, because we are not, we are short of time. We want to train those guys. If they do not have any knowledge, I don't have any problem.
Okay.
The only thing is they should have a knowledge of dentistry at least. If they are coming freshly from the colleges and they think that we'll just start learning implants, sorry, one should start with the general dentistry, and then they should cover, go step by step, rather than straight away coming that I am an implantologist. Maybe if somebody is so God gifted hands, I don't know, but it takes time to learn. I guess I'm still learning. I'm still learning.
Yes.
And I keep on going for the courses, the some modules, and I keep on update myself also. Every month there is something new which is coming. So I guess updating the knowledge is one thing. This is required for the course.
So what's the USP of your academy?
Our vision is like we want that everyone whosoever is coming here they should have a first experience, one-on-one clinical experience on patients. But yes, we cannot give them patients until we get satisfied with them that they are now capable, skilled enough to do such kind of surgeries on patients.
It's very
So-
important. 1-to-1.
One-on-one
One-on-one.
means one doctor, one practitioner, one mentor like me or my colleague or any credential faculties. We have number of credential faculties who are working with us, and one patient.
Okay.
So the day one when they completed the theory part, and the theory keeps on continuing, actually every day we talk about that theoretical part, and then the second thing is the live surgical demonstration. Once they complete the hands-on on dummy models, then we convert the live surgical patients. We demonstrate them on live surgeries. We used to do those surgeries, and they used to see those surgeries. And after the live surgical demonstration, then we used to take a small MCQs and a grand viva sort of for 5-10 minutes, so that we just judge our practitioners that they are understanding the things. This training schedule is not for some certificate base, not for some degree that you are going to hang it on your wall that you have become an implantologist. We want them to learn the basics of it, to start with something that they feel from inner self that yes, we can do that, to make them confident enough to start from some kind of basics to the advanced, some kind of tips and tricks to understand the basic implantology, to do something in case if they get stuck with some kind of complications, they should know how to deal with their complications. And lastly but not the least, the failure of implants.
Okay. Yes.
It do happens. It happens with me as well as if now. But I should know what to do next. So our USP is one-on-one clinical experience, along with after completing the all skilled things and learning the new tips and tricks in the new era of dentistry. That is
What's your vision for international exposure?
as my colleague Dr. Satya Ratarya, he's like a very good person, and per se he's a very good surgeon as well from AIMS. I am also a maxillofacial surgeon. He's also an oral maxillofacial surgeon. He's in University of Buffalo. We are trying to get all the things and certification from University of Buffalo. As if now we are more interested in training part, and we are training each and every clinicians, practitioners from all over the India, so that they will have a good exposure and they will update and boost their knowledge in the area of basic and the advanced implant dentistry. But sooner, I guess, we'll be having the international certification as well. That is in the pipeline, and we're still doing on that, sir.
Thinking that this is in the mid. No, this is not in the middle. Come a little bit forward. Somewhere here. Right now. Oh, just do the here, Professor.
How you will guide your assistant to drop it, and he will give over here. I usually prefer treble.
Yeah.
This is sterile one. Now the surgeon is gonna take it, and then
Now
see.
I'm gonna open it.
Yeah. So we are using a 35 Newton centimeter at 30 RPM.
Okay. 45.
Okay.
Can you see this?
The good thing about ostium implant is its crest of thread is so good that it does not break the bone. The normal active implants usually break the bone on the crest.
So डॉक्टर साहब एक लास्ट क्वेश्चन आपसे पूछना चाहता हूँ कि जो कोर्स करिकुलम है वो क्या है?
The course curriculum में हमने जैसे as we have already discussed कि हमने basic implantology को एक part माना है, because implants कुछ पिछले 15 से 20 सालों के अंदर बहुत ही ज़्यादा एडवांस होते गए हैं, एंड लोगों ने बहुत जो लोग पहले कभी कोई क्राउन या ब्रिज या फिर डेंचर्स लगाते थे, उन्होंने अचानक से कन्वर्जन किया है कि हम इम्प्लांट्स लगाना चाहते हैं, बिकॉज नोबडी वांट्स अ रिमूवेबल काइंड ऑफ थिंग्स दैट एवरीडे वन हैज टू रिमूव इट. जब इस तरीके की चीज़ें हैं तो हमने बेसिक इम्प्लांटोलॉजी को पहले ऐड किया है. See, the basic implantology is basically the implant surgery where practitioners learn the basic part of the implants. That means basic surgical kits, the infection protocol, how to place an implant, single implants or maybe a multiple implants, and how to give them a prosthesis, means उसके ऊपर crowning कैसे करना है, whether it's a cement based or it's a screw retained. This whole procedure takes at least 3 months, means at least 48 to 50 hours of training to learn about this.
Okay.
One cannot learn in a day, because the day when you will do these surgeries, before that you will have to good experience. You have to have a good experience on dummies first,
Okay.
and then live surgical demonstration, and then placement of an implant. So this is a basic implantology, and the whole procedure will be covered in 3 months, starting from the patients to complete the process. The second course which we have started, there is an advanced surgical implantology, which includes those case selection where the basic implantology work does not work in that. Like if there is less of bone, if there is a sinus which is coming down, means ऐसे cases जहाँ पर patient implant लगवाना चाहता है बट आप लगा नहीं सकते हैं because वहां पर कुछ ऐसी surgical complications है that doesn't allow the practitioners to start the implants in that cases. So we want to make them understand the basic part as well as the advanced surgical part of those implants, so that they can do the implant surgery in these patients as well.
Okay.
Then third comes with mastering of implantology, that is master of implantology, in which after completing the basic implantology and advanced surgical implantology, there are still those cases, old age cases, where they really want now the full mouth fixations, but they do not have bone. In those cases, we can go for zygomatic implant, pterygoid implants, means cheekbone implants, and full mouth, like tilted implants, how to do it, when to do it. So these parts come under master of implantology.
Okay.
So I guess one practitioner should go for basic first. If they get patients, they start doing the practice of implantology, then they can go for soft and hard tissue augmentations, implant in aesthetic zone, that is called as the advanced surgical implantology, and then third part is master of implantology.
Okay. So thank you so much. We are very privileged to have you today. And जो हमें देख रहे हैं रेडियो बूस्ट के चैनल पर आप हमें सब्सक्राइब करें, फॉलो करें सारे सोशल मीडिया पर, ताकि आप ऐसी ही यूजफुल चीज़ों को देखते और लोगों तक शेयर करते रहें. Thank you.